All right, 6:21 right now, 69 degrees. As we told you before the break, it is Stroke Awareness Month.
That's right. And we're going to send things out to 3 on Your Side's Jewel Hillary, and she stands by live about some stroke awareness that Baptist Health Center is preparing for us to learn about. Good morning, Jewel.
Good morning, Brandon and Katina. Well, according to the National Stroke Association, there are about 7 million stroke survivors living in the United States right now. And, you know, if you've had a stroke or you think you're having one, it's so important to get to the emergency room as quickly as possible. And we're joined this morning by emergency medicine physician, Dr. Jeffrey Fitzgerald. Thank you so much for joining us. And in our last half hour, we learned about an acronym called FACE, which gives us the warning signs of stroke. Can you quickly tell us what that means again?
Well, it's FAST, and what we're talking about is the F is for face, and what you're looking for is, does that person have any asymmetry in their face? Does one half of their face look weak? The A is for arms. You have that person try and hold up their arms. Are they able to keep both arms steady? Does one drop? Does one not come up at all? The S is for speech. Are they slurring their speech? Are they unable to say things at all? Do they not make any sense? And then T is for transport. That means it's time to get to the ER. If they have any of those signs, you want to be en route to the ER so we can begin treatment.
Okay, and when people get to the ER, what happens? What sort of protocol happens when they get here?
When it appears that somebody might be having a stroke, they become our highest priority. We get them back as quickly as possible. The nurses and the physicians evaluate them quickly, and then the first thing we want to do is get them to the CT scan. We do a CT scan of the brain to see if there's any hemorrhage, because if there's bleeding into the brain as opposed to a lack of blood flow causing the stroke, then treatment options are different.
Well, thank you so much for joining us this morning. Certainly appreciate it. And coming up in our next half hour, we're going to be talking a bit more about National Stroke Awareness Month and tell you about a seminar that's taking place here at Baptist next week. It's absolutely free, and you can learn more about stroke prevention and warning signs. Back to you guys in the studio.
All right, Jewel, thank you for that report. We'll catch up with you next half hour.